New Jersey is just incredibly proud and honored to be part of the Pritzker's Children Initiative. And we truly look forward to our ongoing partnership over the next few years as we really make you proud and reach our goals. So thank you so much. Good morning, everyone. My name is Diane Dellanno, and I am the policy analyst for infant toddler issues at Advocates for Children of New Jersey. And I am really excited to finally be here today. This report was to be released sometime in April, and due to COVID outbreak, we've had to delay it. So we're really excited to finally be able to share this important work with all of you, and look forward to our ongoing partnerships over the next couple of years to make this work happen. Before I go into the specifics of the plan, I wanted to share a short video with you from one of the many parents that we have spoken throughout this process. All of us that are involved in this work truly understand that parent voice is critical to the success of our plan. And we are really committed to listening to and learning from parents to ensure that we design the systems and the supports that families truly need.
So, my name is Camille Harley. I am a sophomore at Essex County College. I study social sciences, and I sell lashes as my entrepreneurial business. I'm also in the process of starting a youth empowerment program called the Butterfly Effect. I'm a mother of two sons, a 3-year-old named Caden, an 8-month-old named Legend.
Hi.
Hi. Giving birth, well, I did twice. The first time was very scary with Kaden. My pregnancy was scary. I got put on bed rest very early, 4.5 months, 5 months. When it came to giving birth, I pushed for almost 2 hours. And in the midst of me pushing, I was going in and out of consciousness because I was pushed for so long, losing so much blood. And my mom felt that I should have been rushed to emergency C-section. I had a midwife and a student delivering my baby. So they was just like, I pushed. When I finally pushed, he came out and he looked at me for like a couple seconds and went unconscious. And it took about 15 minutes for them to get Kaden to be responsive, to get back consciousness, calling for doctors to come in because they need help for him. And it was just like, I'm laying on the table, I don't know what's going on. It was very scary. He is actually asthmatic now. For his first 2 years, I've been like back and forth in and out the hospital for his asthma. It's to the point where we was going there often that they knew while we was there. It was just like they knew.
Great. So as you've just heard, parent voice, family voice is going to be critical to the success of our plan. We want to listen to all these families out there and really get a better understanding of the supports and services that they need so that we can truly be this kind of state that can say that we're the safest, healthiest, and most supportive place to give birth and raise a family. Unlocking potential articulates a strategy to unlock the potential of every New Jersey child to grow up healthy, safe, and educated, and to unlock the potential for every parent, guardian, educator, or service provider to be the best that they could be in their role in the lives of infants and toddlers. Our report was developed by the New Jersey Pritzker leadership team, which was composed of 17 state leaders that included representatives from each of the state agencies serving infants and toddlers, as well as nonprofit leaders, advocates, and funders from across the state. Between July and December of 2019, we facilitated several meetings to look at a variety of issues, including childcare, home visiting, infant mental health, and maternal and infant health. The meetings were facilitated by national early childhood experts, Harriet Dichter and Natalie Renew. And we also invited national financing experts, AJ Chaudhry and Taryn Morrissey, to participate in these meetings to help provide some cost modeling so we could have a better understanding of what the cost to provide these vital services would be. At each of these meetings, we also invited content experts to really help inform our process and provide critical data to give us a better understanding of what the landscape looked like and to identify any additional needs that we needed to address. 2 additional meetings were held following these content meetings that were focused on systems building and communication that we needed to look at as we move this issue forward. The resulting plan was intended to build upon, strengthen, and expand the current work underway in New Jersey to develop new services, and as well as to develop new services to fill in any gaps in order to increase the availability and access to quality services for, as you heard, an additional 25%. And that would be, for us, as we went through the plan, we ended up hoping to reach 28,864 infants and toddlers from low-income families. We understand that it's a bold and ambitious plan, yet we really believe that it is achievable and absolutely a must if we are truly committed to eliminating disparities that impact outcomes for babies, families, and communities. So I'm going to go through the plan, but as you heard, the plan and the reports and all the supporting documents are going to be available on our website. So you can download the reports after this meeting, as well as you could contact us to let us know if you have any questions or concerns, because unfortunately, as Seal pointed out, we are unable to interact with people in this kind of format, but this is going to be an interactive process. So we look forward to hearing your comments and learning from you as we move this plan forward. So our first goal is to reach an additional 8,750 infants and toddlers from low-income households and provide them with high-quality subsidized childcare. In order to do this, we will look at several different strategies. One, we truly believe that all childcare centers and family childcare homes should be quality rated at a level 3. And quality rating in New Jersey is focused on the Grow NJ Kids plan that the state has supported and started several years ago. And we want to support that plan and move centers into the quality rating system and get them rated. So we would be hoping to provide all the supports and the technical assistance that they need to be able to accomplish that. Number 2, we really wanted to develop more high quality licensed slots for infants and toddlers from low income households. As Jerry pointed out, infant toddler childcare is not one of the most frequently available types of care because of the costs that are involved in it. And we want to make sure that high quality care is available for infants and toddlers throughout our state. We also want to make sure that high quality family childcare is also available, particularly in those underserved communities that would have limited or no access to regulated care. We do not know what the impact of COVID is going to be on our childcare system, but we are committed to making sure that quality childcare comes back and is available for everybody to make sure that it's equitable across the state. We also want to fully utilize opportunities to expand the early Head Start model to reach additional infants and toddlers throughout the state. And lastly, what we really need to make sure we address is compensation and credentials for infant toddler educators in childcare settings to make sure that they get the supports that they need to provide these essential services. Our second goal is focused on home visitation. As many of you know, New Jersey has one of the highest rated home visiting networks in the country. We're very proud of the system that we have created. We have home visiting programs in every single county throughout the state. 3 high quality models are in every single county: Parents as Teachers, Healthy Families, as well as the Nurse Family Partnership. So we're very excited that we do have this system that's all coordinated through a centralized intake system. But we know that there are things that we need to do to make sure that there's greater access. So our goal is to reach an additional 9,867 families with infants and toddlers of low income so that they can benefit from quality evidence-based home visiting services. How we're going to accomplish this is we really want to increase the service capacity and program completion rates within our current system of evidence-based home visiting, and also expand access to these services in those communities that will have a greater need for these services. We have been so amazed at the work our home visitation programs have done throughout this COVID crisis. They have been providing vital services to families who are truly been traumatized by the impact of COVID and their children, and have been there for these families virtually. And it's really been an amazing process to watch. Lastly, we also want to reframe and develop home visiting as inclusive for all families who want to participate. We feel that all families need support and education at or around the time of birth, and we want to make sure that it is accessible to all families in a format that meets their needs. So we will be looking at new models to bring across the state to be able to reach additional families. Our third goal has to do with infant mental health services, and we would like to reach an additional 7,247 infants, toddlers, and their families, and bring them quality mental health services. With this goal, we're going to have to do two things simultaneously, because in order to increase services, we're definitely going to have to increase the supply of well-trained infant mental health professionals. So we're going to be looking at a number of different models. One would be the infant mental health consultation model that is currently offered in childcare settings, but we do want to bring it to additional childcare programs throughout the state. Another thing that we'd like to do is make sure that those children that have been identified as having additional needs through the infant mental health consultants working in childcare settings, that they would be provided with more intensive mental health services as needed. Another option that we would like to look into is providing infant mental health consultation in pediatric settings. That is where babies are seen most frequently, as we know, and that's where they could be reached and have their needs addressed right there when they go for their well baby checkups. Another goal of ours will be to increase the availability and access of infant mental health treatment services throughout the state for any family that is in need of services. And as I mentioned earlier, increasing the supply of well-trained infant mental health professionals is going to be critical to making sure that all of this can happen. And we also have realized that throughout this process that documentation seems to be lacking for us to be able to say what the actual need is for mental health services. So we're going to be looking at different ways to document and demonstrate the need for these services and supports for infants and toddlers specifically. Our fourth goal has to do with ensuring equitable access to maternal and infant care supports and services to ensure a healthy birth. As you heard from our First Lady, that this has been a high priority for her and the Murphy administration, and we're excited to partner with them on this initiative and able to help us to reach an additional 3,000 more women of low-income households. What we will do with this particular goal is coordinate and align with the activities of the Healthy Women, Healthy Families initiative to ensure that more families have equitable access to maternal and infant care. And we will be supporting the Nurture New Jersey campaign that the First Lady mentioned in her opening comments. And we also want to partner with them on establishing the right kind of metrics to assess birth outcomes, to monitor our progress, and promote positive practices among the healthcare community. And then finally, our last goal is a systems goal. What we want to make sure is that as we're developing all of these services, that they are connected and that there is a system that is in place throughout our state to enable more families with infants and toddlers to be connected to critical services to ensure their healthy growth and development. To do this, we really want to strengthen our existing county-based central intake hubs in their role as a system connection between families and critical maternal and child health and early childhood services to make sure that all families can be connected to those services that they need. We want to maximize parent voice. It's critical to our work. We need to know what they need, what their needs are, and how they feel these services would most benefit them. We want to involve them in leadership opportunities, ensure that their voice is included intentionally in all of the work that we do. We also are going to be supportive of the New Jersey Council for Young Children, which has been around, now I think it's about 12, 13 years, at least since 2009. And they are the coordinating entity to align services, assist families, and inform the system of any needs, gaps, and opportunities. So we'll be partnering very closely with them in their work to make sure that we are creating a statewide system. And we are going to be continuing this work of the PCI leadership team. And we're going to be adding to our leadership team and coordinating with our existing New Jersey Think Babies Coalition to make sure that a greater number of persons are involved in this very important work. We've created work groups for each of the priority area, which everyone is welcome to participate in. One of the silver linings to COVID is that when things are moved virtually, you can really engage a greater number of people in this work. So we're excited, and we've had great participation, and anyone who is interested in working with us on this plan is welcome to join us on those work groups. And if you need any additional information, you can reach out to ACNJ and we'll be able to connect you with the group that best reflects your skills. Okay, so in closing, I'd like to show another quick video before I turn it over to the panel.
So my name is Laura. I am 21 years old. I currently reside in Mattawa, New Jersey. I definitely have a lot to juggle. I work full-time. I go to school full-time at Ocean County College. I'm a mom with 25/8. This is my daughter, Leilani. She was definitely a surprise, but she's a great blessing. She makes me so happy every single day. She makes me learn things every single day about myself too. I think I was leaving the OBGYN one day in Lakewood and I got a call and a lady said, hi, you're eligible to receive home visits from Family Nurse Partnership. I just wanted to know if you're interested. It's just, a nurse comes to your house once every month and it's just all baby talk. And I said, you know what, why not? It can't hurt. I have a great nurse. Her name is Patricia. I call her Trisha for short. That's how she likes it. During our home visits, she, opened opportunities to apply for these amazing programs such as WIC and how to get my free breast pump and childcare subsidy. And I didn't know these programs even existed. I didn't know anything about this. I didn't know where to even apply, where to even look, or who to even call. Trisha gave me breakdowns, websites, phone numbers, places to contact. She would check on my blood pressure every single visit. She would just ask me how I'm starting to prepare for, labor, or we would go over, these seminars that she would bring about what to expect in labor or what to expect when having a baby or what I should be eating, what I shouldn't be eating, when to have the diaper bag ready, all those questions that just flood through your head. As soon as I was in labor, she was I think one of the first 5 people that I texted and said, Trisha, she's coming soon. Yeah, Trisha's amazing.
Which is going to talk more about the different services that we have proposed in our plan.